listening to Focus Black Oklahoma. I'm Associate Producer Smriti Iyengar, and as we near the end of celebrating Women's History Month, we bring you this special podcast edition of our show, featuring 3 segments about Black and Native mothers and their experiences with healthcare. Black women in Oklahoma face disproportionate challenges when it comes to surviving childbirth. In this first segment, which aired in June of 2020, Autumn Brown explores the historic precedents that perpetuate this daily trend and its pervasiveness through the country's healthcare industry.
The news of pregnancy, for some, is a momentous occasion filled with celebration and excitement. But for Black women in Oklahoma, pregnancy is sometimes a matter of life and death. Black women die at nearly 3 times the rate of white women during or shortly after pregnancy. In addition to that, for every 1 woman who dies, there are about 70 who have life-threatening complications related to birth or pregnancy.
During pregnancy, I think there were probably signs there. I was under the care of a OBGYN and a high-risk OBGYN. So I felt like my doctors were super amazing. Me being in the professional world and me being an educator to women about the importance of taking care of themselves during pregnancy and stuff, I didn't even really realize the things I needed to be watching for myself.
Marnie Jackson gave birth to a healthy baby girl, and it almost cost her her life.
When I got to the doctor's office, I felt so bad that I was praying that they would just admit me because at this point I couldn't breathe. Well, I continued to get worse, and I went in for the next couple of weeks, once a week for checkups, and she told me that it would just take time for me to get better because I had double pneumonia. So going into my 4th week, my oldest daughter came home from college, and at this point, I couldn't even probably walk 5 steps and felt like I was about to black out. So I drove to the hospital and I wrote down all the things I was experiencing, which was back spasms, chest pains, double pneumonia, and shortness of breath. And so I went to sit down in the lobby and they ran all the initial tests. And so they hooked up the EKG machine. They started doing an ultrasound on my heart. And at this point, they're putting me in the back room and telling me that I'm possibly in heart failure and was on the verge of a heart attack. So after they got all their tests ran and everything, at this point, I was so numb to the situation because I felt like I'm in a safe place now that if anything happens that I'm here. They finally have me in a room. They're not going to turn me away now. So I am in a safe place. So if I stop breathing right now, they're here. And so finally, once they did get all the test results back, they came in and they told me my heart function was at 15% and that one more day I would have had a heart attack.
Maternal mortality among Black women is a systemic issue with a myriad of factors, including barriers to quality health care, racism, and unconscious bias. Labrisa Williams, who is executive director of the Tulsa Birth Equity Initiative, speaks to why such a gross disparity exists.
Yeah, so the disparity that Black women and Black mothers are experiencing is a clear sign that structural racism exists. And race is one of the most reliable predictors of life outcomes across several areas, as well as maternal mortality. So there's no educating ourselves out of this issue or making more money to really escape the inequities that Black women and Black mothers experience. Some of the things that I've learned through, research and learning more about Black maternal health is the lack of communication and teamwork is a root cause. And when Black women express concerns about how they're feeling, particularly around pain, the health system is slower to respond.
A lack of communication and teamwork were both factors in Marnie Jackson's near mortality after the birth of her 4th child.
It made me realize that I wish the OB and the primary care doctors communicated because I felt like I was the go-between between, if it was something going on with me and I didn't feel well, I would call my primary care. My primary care didn't feel comfortable prescribing or doing anything without approval from my OB, but it was almost like they never took the time to just pick up the phone and call each other.
What makes the statistics surrounding maternal mortality for Black women more shocking is the fact that maternal deaths disproportionately affect Black women regardless of socioeconomic status or education. This issue isn't exclusive to only poor Black women. Beyoncé suffered life-threatening complications with the birth of her twins, and Serena Williams almost died after an emergency C-section delivering her daughter. Hence, we cannot educate ourselves out of this problem.
And so regardless of income, regardless of education, and there are many data points that also talk about how Black mothers with college degrees have higher rates of harm than women of all races without high school diplomas. And so it goes to show that regardless of education level, regardless of income, the risk factor is that I am a Black woman.
Unfortunately, the problem with maternal mortality rates among Black women is not unique to just Oklahoma. Across the country, Black mothers die at a rate 3.3 times higher than white women. The Pregnancy Risk Assessment Monitoring System is an ongoing population-based study designed to collect information about maternal behaviors and experiences before, during, and after pregnancy. This study found that pregnant Black women, on average, receive differing medical information from their doctors than white women. While white women are informed about proper nutrition and appropriate weight gain, Black women are counseled on illicit drug use and physical abuse.
The problem exists to systematic racism, including at the hospital level, and then implicit bias on the part of people working within the healthcare spaces. And so hospital programming is designed to make the hospital system and the birthing process more trustworthy and accountable, and not asking community to just trust. And so systematic racism exists as it is systemic, and it is deeply ingrained in all sectors, including healthcare settings.
Some researchers also point to racial weathering as a factor to consider. Racial weathering is the result of chronic stress in Black women that can lead to other health problems. Though implicit bias and racism are taking a deadly toll on Black mothers, there are ways we can save ourselves.
Yeah, I would encourage Black birthing people to get support from birth workers, doulas, midwives, birth workers of color that have some shared lived experience as them, and find people that can advocate for them on their behalf during and after childbirth.
It is an everyday fight for Black women mitigating the hospital-industrial complex. And as they struggle to be heard, fiercely using our voice to shed light on this epidemic remains imperative. For Focus Black Oklahoma, I'm Autumn Brown in Oklahoma City.
Would you like to pitch a story to FBO?
Or work with us as a correspondent?
Please email us at contact@focusblackoklahoma.com.
Two different cultures find common ground through a shared love of caring for new mothers and connecting a treasured past to present realities. In this next piece, which originally aired in August of 2021, Britny Cordera has more.
In the Black and Native communities, one will find solidarity between them in the ways that they preserve their identities and give back to their communities. For both, rematriation work is an important form of culture preservation and activism. Rematriation takes many forms, from language preservation, practicing ceremony, taking care of the land, and even birth work.
Birth work is rematriation work. And for me, rematriation is about the balance in relationships. It's about consent culture, body sovereignty, reciprocity, and recognizing the power of inclusive and ancestral knowledge systems.
This is Jaysha Lyons Echo Hawk. They are a two-spirit mother, birth worker, graduate student, and founder of Indigenous Milk Medicine Week, which is occurring this month. She is an enrolled member of the Seminole Nation and descendant of the Pawnee, Iowa, Omaha, and Creek tribes. As a certified birth worker and student midwife, she uses her role to empower birthing people in the Native community.
So my Pawnee name is pronounced Titata Chikstariku, which means she who thinks with her heart before she speaks. So a lot of this care work, a lot of the work that I do is very intentional. I have to continue to make sure that it lines up with the mind, heart, and spirit. So it is very spiritual work.
As an Indigenous birth worker, their role goes beyond just supporting mothers during this transitional experience. It's about giving birthing people the tools to have a sacred birth experience.
As a birth worker, I support traditional kinship roles and practices before, during, and after birth. And I also am learning that I hold a role to support ceremonies that will support those life givers, such as coming of age or celebration of your last menses or your last period ever. As a birth worker, I build relationships and advocate on public concern and service to the individual, to the community or the family. Birth worker, for me, an Indigenous birth worker, serves to hold space in a variety of capacities that would otherwise have trained doulas existing outside the scope of their quote-unquote birthing work.
In fact, Ziara is more than just a support system. She prepares mothers with the tools to have a healthy mind, body, and spirit. She cooks meals for her clients and teaches them about healthy nutrition.
Yeah, just teaching them how to advocate for themselves in the medical system, as well as helping people to learn how to just be healthy all around. Pregnancy is a time when a lot of people start to take a look at what they're putting into their bodies, about what they're doing with their bodies, and just take a little bit more care, because carrying new life, the mother is so sacred that she is able to do that. It's really a wonderful time to just be inspired by what's happening within one's own body and be inspired to do the things that one needs to do in life in order to cultivate wellness and health and prosperity and all good things for themselves while they're growing their babies, and also just to pass on to their children as well.
For both Jaysha and Ziara, birth work for them is a way to ensure birthing people are not taken advantage of in the medical system. They both had a calling to pursue this work amidst the pandemic and political upheaval of last year.
Being a doula means a lot to me, and it started with last year when all of the protesting was going on over the murder of George Floyd and Breonna Taylor, and just the outrage in the community and just the state of our community as Black people in America. So at the time, I didn't really know what to do. I wanted to be able to be there for my community in some way to change what's happening. It wasn't more than 2 weeks later that a friend of mine had made a post on Facebook just saying that we needed more Black doulas and midwives. And I knew what a midwife was, but I wasn't sure what a doula was. I had never heard of a doula before. So I did a Google search, and learning about what doulas do as advocates, as educators, as guides through the pregnancy and birth experiences and postpartum as well for some doulas, to help empower mothers, to help them have healthy and positive and sacred experiences. I just knew immediately that this is where I was being called to help.
It was way more obvious to a lot of our, world in 2020 with the uprisings, with noting, racism as a public health crisis and seeing all these folks suffering at the hands of police violence, of state violence. I felt really compelled to I've got to jump. I've got to do something that is going to be more, how to say it, more of an impact, I felt. And so, when I reached out to these midwives, I was like, can I start training now? We're grounded in such a large way, and yet this work has to continue. These people are still needing to be served, and it'll take time, but with the knowledge that I'm gaining, I'm still able to be a better advocate or a stronger advocate or a more informed advocate in this birthing space And so, of course, they welcomed me right away. And so it's been really interesting to be on a different kind of front line during this pandemic of getting exposed. I don't know how many times before I finally got COVID.
For Focus Black Oklahoma, I'm Britny Cordera in Pawnee Nation, Oklahoma.
The insidious aspects of implicit bias are an ever-present part of the lived experiences of people of color in America. Black women are the most susceptible to bias through the lens of the healthcare system. Dr. Jabran Pasha has the story about the Tulsa Birth Equity Initiative and its mission to ensure that more pregnant Black women have the medical support they need through their doula program. In this next piece, which originally aired in February of 2023.
The COVID-19 pandemic has highlighted health inequities in the United States. As the country tries to make sense of seemingly unbelievable infection and death rates that marginalized people are experiencing from COVID, many healthcare institutions and community organizations leverage the data from these disparities to have more conversations about health inequities in general. Amongst the many health inequities, maternal mortality rates of Indigenous and Black women garnered a great deal of attention.
We know that women of color, specifically Black women, are 3 to 5 times more likely to die from childbirth.
That's Amari Jimerson, Executive Director of Tulsa Birth Equity Initiative, or TBEI. Before joining TBEI in September of 2022, Amari served as Deputy Director for Tulsa Parks. Now at TBEI, Amari is working to address the maternal mortality disparities in Tulsa.
Historically, we could get into the whole systematics of the way racism exists within our culture and country. Definitely the way people live and experience life as a person of color. They are more prone to different stressors, which ultimately lead to negative health outcomes, which we've seen not just in maternal health, but across all different areas that health touches. And then going back to the system, a lot of people think that it means that a provider may be racist. And it's not necessarily that they are intentionally racist. It's just the way we've all been programmed coming up in our culture. And when we see someone, we ultimately make a decision. So there's that natural bias that comes out in the care that the woman receives.
The impact of implicit bias on people of color, especially Black women, is well documented. Studies have shown that Black women often feel unheard by their physicians. This is not just perceived. A 2016 study in the Journal of Clinical Oncology found that non-Black physicians spend less time with their Black patients, less time listening to them, yet more time talking during encounters.
So we have a couple of different ways that we like to attack the issue. So our biggest program, our flagship program, is our doula program, which I'll let Ashley tell you a little bit more about, but providing support and services for women who are pregnant as well through their postpartum care up to 12 months. We also do a lot of work with hospitals in our hospital quality improvement program. So things like teen birth, which actually works to make sure that the patient is included in the voice to determine their care. Getting ready to approach another program where we dig deep into the data that hospitals collect around maternal care so that we can identify the areas that they need support in. We also are about to launch a preconception program called Embrace. We think we need to be working with women before they become pregnant to make sure that they're making healthier choices that will ultimately lead to healthier births and healthier outcomes for them as a whole as a woman. And then we also have a program called Queen's Village, which is basically just a safe space creating community for Black women. But we know that when women have an outlet to release their stress, it leads to healthier outcomes.
The American College of Obstetrics and Gynecology and the Society of Maternal-Fetal Medicine reported that the continuous presence of a doula during pregnancy is one of the most effective tools to improve labor and delivery outcomes. Doulas have been found to spend as much as 6 to 11 times more time with expecting mothers than the clinical healthcare team. This contact is impacting clinical outcomes. A 2017 study in the Cochrane Database of Systematic Reviews showed that pregnant persons who use the support of a doula are less likely to require cesarean birth or use pain medication, and more likely to give birth spontaneously, with shorter labor times. Patient experience is improved as well. Even with that data, many people are unfamiliar with the term doula. TBEI is working to make doula a household term. Ashley Wilson is the manager of TBEI's community-based doula program and a practicing community doula.
A doula is someone that provides physical, emotional, and informational, educational support to pregnant people. So what we do is we visit with our clients once a week, all through the prenatal part of pregnancy. So prenatal, we're there all during labor and delivery. And then we visit 2 to 3 times a week postpartum. For the first 2 to 3 times a day, for the first 3 weeks, and then once a week up to 3 months. And then we have the ability to extend that a year if the client feels any additional support. So we do a lot of touches with the clients, like a lot of visits, really getting to just interact and get to know them and give lots of information.
Despite the known benefits of a doula's support, only about 6% of pregnant persons use them. This may be due to lack of awareness or financial barriers. Many health insurance companies do not cover doula care, leaving mothers to pay out of pocket. Although cost varies, traditional doula care costs between $500 to $1,500 or more. A cost burden that many families may not be able to bear. That's why TBEI offers doulas at no charge to the client.
You know, it's really difficult to worry about your pregnancy and your birth when you're trying to figure out how my life's going to stay on and what am I going to eat today. So the fact that we're able to go in and provide resources and assistance, extra help in that area, I think that's another difference between community-based doula work and traditional doula work.
TBEI prides themselves on being able to offer doula services free of charge. Clients do have to meet criteria, however.
So in order to be to receive a doula, you do have to meet certain criteria, which is live in the Tulsa city area, as well as be a part of one of the 4 communities that we serve, which is Black women, Native, teens, and justice involved. And so if you meet that criteria, there is no income limit or income range. It's just meeting that criteria, live in Tulsa, and then be a part of one of those communities. Then you can receive a free doula. We typically try to match our clients with doulas that are of and from the same communities. And so a Black woman would get a Black doula. A teen would get a teen, not necessarily a teen doula, but maybe a doula that was a teen parent. So definitely try to match our clients with people of and from the same community. However, if we are unable to, we still recognize that, definitely based on data, that having a doula is better than not having a doula, especially for those communities that are at risk. So we do try really hard to match you. If we are unable to, you are still able to receive a doula.
TBEI feels it is critical to educate the community on what exactly a doula does and dispel any myths.
Yeah, so it's really important that we know that doulas don't come in. We're not the muscle. We are there as a support. We like to work with the nurses and work with the doctors and everyone on staff to give the client or patient the best care. And so it's not that we are coming in and trying to take over anyone's job. It's really just coming in and seeing how can we help you. So sometimes us being able to come in, nurses have a lot of patients to care for, and so we can come in and we can do a lot of things. We can do position changes, and we can make sure that they have water and things like that, just to kind of take the load off of the nurses. And so we really like to work in conjunction with the medical team.
According to Ashley, there are many misunderstandings about the role of doulas.
So a couple of misconceptions or myths that we have about doulas is, one is that you have to be having a home birth in order to have a doula. And that's not the case. So we support anyone in their birth journey and whatever experience they choose to have. So if you want to be in the hospital, if you choose to get an epidural, if you choose to be induced, if it's a cesarean, if you choose to be unmedicated, just whatever you desire, we are there to support you in that, and that just make sure that you have the best birth experience that you can have. So that's one. Two is we are not midwives. We are doulas. So doulas are non-clinical, non-medical support people. So we don't do medical things, right? We don't do cervical checks, blood pressure checks, like any of those things that a midwife or an OB would do. So that's another one. And then the other one is that we are, again, a support person. We are not here to push any family, any partner, or anyone out from the experience. We really want to help support everyone. It's kind of likened to a wedding planner. So when you have a wedding planner, the bride and groom, they hire someone to help plan their wedding. It doesn't take away from the groom's part, from the mother of the groom, mother of the bride. It doesn't take away from anyone's part. They're just there to help facilitate the wedding and make sure it goes according to plan. And that's exactly what a doula is. We don't want to take anyone's place. We really want everyone to be involved. We're just there to help facilitate and make sure that the birth experience is what they desire.
In addition to providing community-based doulas, TBEI offers training to community members to become doulas.
Yeah, so first, being a doula is an amazing job, best job ever. And so what can you do? So TBEI does train community-based doulas. And so we have a training that happens a couple of times throughout the year. If interested, they can always go to our Facebook page or our website, tulsabei.org, and get additional information. The training, it's a 20-session training. We've had, so it's very intense, lots of information, lots of hands-on, work. And so it's really, really intense in that sense. But when you leave, you definitely leave feeling like you have all the tools to be a successful doula.
Tulsa Birth Equity Initiative is looking to create a community where Black women feel heard, respected, and safe. We hear again from Amari.
For our doula services, you can go to our website and self-refer. And then also Queens Village has a bunch of listening sessions coming up, one that'll be March 25th. And what we're trying to do is get Black women to come out and tell us the activities that they want to do as a Black community of women as a part of Queens Village. And all of those listening sessions will be at the Black Wall Street Liquid Lounge. Go and check out our Facebook and Instagram pages, Queens Village Tulsa, and you can pre-register for those.
For Focus, Black Oklahoma, I'm Dr. Jabron Pasha in Tulsa.
Focus Black Oklahoma is produced in partnership with KOSU Radio and Tri-City Collective. Additional support is provided by the Commemoration Fund. Our theme music is by Moffett Music. Focus Black Oklahoma's executive producers are Quraish Ali Lantana and Bracken Clark. Our associate producers are Smriti Iyengar and Jesse Ulrich. Our production intern is Daryl Turner. You can visit us online at kosu.org or focusblackoklahoma.com and on YouTube at Tri-City Collective. You can follow us on Instagram at FocusBlackOK and on Facebook at facebook.com/FocusBlackOK. You can hear Focus Black Oklahoma on demand for free at kosu.org, the NPR app, npr.org, or wherever you get your podcasts.
Thanks for joining us on Focus Black Oklahoma.
Geez, oh, Petey's.